സയൻസ് കോൺഗ്രസിൻ്റെ ഭാഗമായിട്ട് പേപ്പർ പ്രസൻറ്റേഷനിൽ അടുത്തായിട്ട് നമ്മുടെ അതിഥിയായിട്ട് എത്തിയിരിക്കുന്നത് ഡോക്ടർ മന S.P.Brown ഫ്രം ഇറാൻ. ഹലോ.
Hi everyone, I'm basically from Iran and I want to say that it's very good. Congratulations Kerala. First time which I saw your photo, it was few years back. That time, I don't know which people we were. I said these people will pick up. And those people around me, they said, no, they'll be small and it's just 1 year. And I'm very glad that you could pick up in this, and I'm sure you can pick up also more, and you will develop. That is a very good community you started. And I'm thankful to Dr. Samuela, which I learned acupuncture from him only. He's a very good teacher and humble teacher. And any other people who helped me in this field. Before starting, I want to say just one word. I'm thinking you are not the person who selects the medicine. In fact, medicine is the one which selects you. I was the one who always was running away from medical field. But wherever I went, I was blocked and I was again pulled back to the medicine field. And if you are in this field, be sure you have to be here and better to learn day by day, because you were the one who were chosen to do something in the medicine. About this acupuncture in genetics, I think it's good we start to talk about that, since often we hear about genetic disease, all the diseases are from genetic basically. We know, should I change it myself? You will change it or what? This goes forward. Genetic disease always will be very difficult for us to treat, very difficult for us to understand, and it will remain mystery from any aspect which we look at it. In diagnosis, we'll be confused how to diagnose. After diagnosis, to find out the root of the problem, again will be difficult. For the treatment, we'll be having more challenges. Once we come to genetic diseases, we can classify them differently. Like if the chromosome has been changed, if a small gene has been changed, if many different genes has been together worked wrongly or went wrongly, different classification is there. I think most of you will be familiar with that. I just skip that. And let us look at genetics in acupuncture, how acupuncture can diagnose this disease and how can treat it. From acupuncture aspect, when we look at genetics, we can understand genetic problem are not just like accidental problem which they occur. They are fundamental issues which they are coming. When we are getting produced, when the human body is made, there are certain plans for this. One of them is to be alive. If you want to be alive, there should be proper program for that. These programs are going to be under control of some genetic issues or genetic fundamental and basic genetics in the body, which we can call it genetic of life. Genetic of life is the one which helps us just to be alive, as a person to be able to breathe and not to be dead. And as we are living as a living thing, not just human being, once we are living, we have to undergo many changes. Like trees are doing the same thing, animals are doing the same thing, we are also doing the same thing. The genetic diseases come to this category will be evolutionary. diseases or evolutionary aspect of the diseases, and then we are having this natural selection. This was not my topic today, but I talk about that as well. In genetic, we will face some organs are having more involved. Spleen is more involved. Kidney is more involved. Other organs will be brain or nervous system, which we can call it pericardium, and pancreas. You just remember these names. Genetic of life will be controlled by kidneys, the water of the body. Genetic of evolution will be controlled by spleen. And genetic of the natural selection, which we will talk about it, will be controlled by pericardium, which I call it brain, and pancreas. What is the meaning of the genetic of life? Genetic of life is just let you to be alive. If you want to be alive, sometimes you have to face some other challenges. Sometimes children will be born abnormal. Why they are born abnormal? Because they have to be alive. Once we understand a person is suffering just to be alive, it means there was some issue which was very severe. And if body did not want to do certain changes, that person could not get a chance to live, even if it is just a second. The embryo which is formed inside will take these challenges to become sick. The heart doesn't develop, the hand doesn't develop properly. Just to live one day more, 1 month more, even just be born that moment, die. They don't have hand, they cannot breathe properly, their heart is not proper. But it is important that living just to be alive. What is genetic of evolution? We are going to face certain challenges because we have to build our body to become stronger. To become stronger, we should face some strong attack. These attacks and these changes will be supported by the earth of the body, which is spleen. The same earth which is outside can manipulate certain things inside our body and face us to see so many different things like cancer, immune disease problem, and many certain things which spleen will be controlling that and will do this one. These genetic issues don't care you are alive or you are going to die. They don't bother about your death. These ones, once they come, they will never ever leave your generations. Till end, they are going to be with you. Even if a person is having cancer and the children are not having cancer, it does not mean it was just on the mother and children are fine. The next generation, or maybe 10 generations after that, a stronger type of, this type of genetic issue will come back to the same line. The memory will be there, because these are the ones which have to make any living thing to take this challenge. Like if you are putting the crops, if you keep the same crops in the same lands, after some time land will push it back. You can't grow it again. You have to do certain changes. For other living like animal and like trees, which they are big and more away from the ground, and us as well as a human being, we will have this type of genetic challenges always. It is not a new challenge for us. It is not a new genetic things. It was there and it will be there definitely. Only the severity will be less or more. Because this one are in communicate with the nature as well. If outside we are having certain chemicals, will affect on them more. Natural selection is the one which mostly we will hear it and we are familiar to it from the childhood. It is if you are strong, we can live. If you are weak, we cannot survive like that. We talk about it more. which this one, the natural selection will be controlled by brain. We just keep it, brain means pericardium here, and pancreas. If you are seeing a patient is having problem in the pericardium or pancreas, any of them, we can check cross with the other one as well. If pericardium is having problem, check it if pancreas has problem. If pancreas has problem, check if pericardium has problem. Most definitely both of them will have, and both of them most of the time will affect on reproductive problems. Reproductive parts somehow will be some change in it, whereas on the same person or on children, like a person having diabetes, the child of the same person will be infertile, or the person will be having some issues in the pericardium or pancreas, and the child will be having some other type of genetic problem and cannot reach to the age to marry or get a child. We'll have one quick review on genetics. See, genetics, when we talk about it, mainly we talk about nucleus. In nucleus, we have DNA. DNA will give a message. We have RNA, then we have products. It can be protein, enzyme, or whatever. There is a product to do work for us. In this chain, wherever there is any issues, we will say there is genetic problem. But most often, if there is genetic issue on the DNA, that will be more important for us and more challenging to treat it. Also to diagnosis. Since there is not much time, I just skip many of the things. Later we talk about that. Any nucleus of the cell, as I said, it has a memory, and that nucleus is a boss for that cell, and this memory will remain till end of the generation of this person, till it finishes. We are having certain cells and certain components in the body which they don't have nucleus, I mean they don't have DNA. One of them is red blood cell, one of them is platelet, and many other components. These components production is mainly under control of water of body, under control of kidneys. Why it is so? To let them to survive more. They go under living category where body is supporting them. In fact, we can say kidney as the water is helping us to live, however, cause sometimes some issues for us, some genetic problem for us, and trying how much is possible to help us to escape from any changes can happen in the nucleus. Or in a simple word, we can say it can support us from spleen, because spleen always is putting us in a big challenges. On the other way, we are saying liver also, son of the kidney, son of the water, which that one also helping with the kidney, helping with many of the production in the body which are under control of water. At the same time will help us again to be protected against spleen. We are having a stomach. It's good to know about this stomach. A stomach is the young for spleen. Spleen is the one which causes many of the genetic problems for us. But the stomach as the young, try not to do that. It's not like a spleen that much to put us in trouble. But it's a weak point which a spleen often can overtake that, can often start the problem from the stomach itself. Since it's just young for that and it put on in the weak condition, which a spleen can just easily start its problem from there. That's why many of genetic problems starts from stomach or large intestine. Okay, if you have time, we can do these ones as well. See, This one, as I said, no, the body always try for living. That's why we'll do all the plans to support the living. Makes most of our body made from water. Many of the important cells and important components which are good for the living, they are having water connection, whereas directly or indirectly are connected to the kidney. It is tried to be skipped from the spleen. We shorten that. In one way, we can say kidney guardian of life, because it always tries to help us to live. If a person is facing the genetic issues which are under control of this, often we should think, if we are able to find out the bigger problem, solve that one. Or else we should let it to just handle that issue for some time, because living is more important. Kidney doesn't care your suffering. Maybe just make you to have too much pain, too much suffering, not be able to breathe, your heart is beating so badly, your stomach is bloating too much, but just want you to live. And as long as does not get the message that you can live without help of that, is continuing to make you sick once it is matter of genetic problems. But the spleen in other ways always is challenging you with the very big problems. One of the big one is cancer, which will be always there, autoimmune diseases which are always there. Mostly will attack directly on the DNA, directly on the nucleus, and is trying always to take a control. If you are seeing in many of the problems which are causing from the spleen, finally it will come to take over the liver. Why is trying to control the liver? Because we know liver is always protecting it, protecting the body from the spleen itself. If a spleen can take over the liver, almost is ending. After that, there is not much help for the body to be able to get out from the issues which face. These 4 C's also, if you see, that is a good thing. When you see about the 4 C's of the body, we are seeing no spleen points here, but there are many stomach points which makes it weak. Now, if you want to diagnose these issues and to treat it, what we should do, first we check the pulse. If you are checking pulse or you are doing other techniques, just do it in the minimum way. Whereas it's deficient or it's excess, or you can do much more detail in the pulse. Or if you are doing some other diagnosis, once you have the data, second will be analyzing on the data. You are having all the data, 12, 13 organs you already checked. Then you see which one is excess, which one is deficient. Among that, you can have some analyzing. Suppose you are having pericardium is excess and kidney is deficient, or you are having liver is in excess and spleen also is in excess, pancreas is in deficient. From this small data which you are collecting, if you are analyzing, you will be able to understand first this genetic issue, if it is there, belonging to which category, or at all this person is having genetic problem or not. In acupuncture, usually in the clinics, what happens in majority, I don't say all, once the patient go with a genetic problem, the doctor also think, can I do anything? Can I treat it? Second, if patient doesn't know has the problem, doctor may not even think can detect those genetic issue. And if detected, cannot tell the patient. Suppose you detected the person is having cancer. Can you tell her you are having cancer? You may think patient already doesn't know. She didn't do a scanning. But cancer is not something that it is not like cough and cold, that you see it. Cancer, we said, it starts from somewhere which the person doesn't see it, because the spleen is so much challenging. Once it starts it doesn't start it big. It started, makes its root everywhere. Once the root is made, the web is made, then it will show it. But this showing up, it doesn't mean it wants to show you, I'm here, you come remove me. This showing actually, it means, I'm here, come and see if you can do something in this spot. For example, you will be having a gland somewhere on the chest. It doesn't mean this is just a cancer tumor, you remove it, you will be fine. If you remove it, maybe momentarily in that part you feel it relaxed. But once the tumor is shown, or once the cancer is detected for the first time, it means already cancer has been spreaded wherever it should. And cancer, like these spleen genetic problems, they are having their timing. They know when and where, what they should do. They know when they should come to which tissue. Like a root only, they go wherever they want, they get rooted there, they get nested there, they try to control their host there, and always they are ready to change. It's not they don't change their program. Suppose you come with some radiation, they are ready to change their program and become stronger. And they will continue this fighting with you and challenging your kids and your grandkids, till one day, whereas you be much more strong, whereas you finish. Okay.
Just a second, you just continue. Maybe you wanted to report your room, and can you give the chabi of your room? Is there or here?
No, it's with me in my bag.
Please give me.
40 minutes?
No, you finish.
5 minutes and finish. Then when we want to diagnose, I said first we get the data, even if it is a mild data. After that, you just do analyzing those data. Analyzing is very important, and don't be frightened if I detect this genetic problem, what is going to happen. I cannot tell the patient, I cannot treat that condition. First you get the data, analyze the data, put that condition which a person is in the same category, whereas it is in the kidney category, spleen category, or natural selection category. If it is in the kidney category, you want to treat it, you should be knowing there is some bigger problem. Then first you should treat that bigger problem. Like this, you are giving it a message to the kidney that everything is fine, we are ready to help you. Now step by step, I will help you to improve and get out from the disease. This is the way which we can treat this disease. If you are seeing it is from spleen, you should also program very quick and very clever. You should make one plan which quickly to be able to detect the cancer and be sure your treatment is much more stronger than spleen issues. If it's not stronger, it is lost. Again, you should think about another type of treatment and some other time. If the body also is too weak, is okay, yet you can do your treatment. But your treatment should be strong enough that once you do it, quickly to be able to detect whatever issue is there coming from the spleen and remove that one. And if it is from the pericardium and brain or pancreas, which we say they are connecting together, that one I think is more difficult compared to the other two. As many times we may not even understand, like diabetes we think is very common, let it be, no problem. Or sometimes we lose the patient very early. For that one, if it is, the problem is mild, or is early of that problem, as early as possible, just the child is born, that time only we start the treatment, will be more successful. But for that we have to take little longer time, that step by step to recover issues from both of them. And if it's necessary, we go again, try to treat spleen as well. We can say spleen treatment is required in many of the genetic issues. I'm hoping you can do that. I put some, these are just sample treatment. Suppose you want to treat spleen, what we do? First we clean entirely whatever is there under spleen. In this technique which you are using, in 3 steps, we are going to killing, if it is, for example, cancer, you are treating entire cancer. And the last, fourth sitting which you are giving to your patient, you are giving little strength. That strength means you are giving the message to the body, make new cells which they are not having that genetic weakness. Then cancer cannot come back. This is one of the techniques which you can use for kidney issues. These are general techniques, but usually they are good for most of people. And for pancreas issues, this is from one side you go and you can, from left or right, you will start. Some points will be, once you come to the middle of the body, your point will be the other side. But it is simplified, just the point on the right and left has been written. I hope you can use this once. My time is over, you can't talk more. But don't be afraid of any genetic issues, as this is challenging for any type of medical things. And if you fail in this treatment, fail in diagnosis, don't think your patient can benefit from somewhere else. As I said, when you're seeing the tumor, if you cannot treat it, somebody else also cannot treat it. If you cannot detect it, they also cannot detect it. But at least you have more chance to be able to detect it, also for treating it. Sir, I think my time is over. Okay, my time is over. Anything you can ask, after that we can discuss. Take care.